If you are planning to have a C-section sometime soon, this is for you. So maybe you think that a C-section is the easy way out, or maybe someone told you it's an easy way out, but let me stop you right there. This is what really happens when you go in for a C-section and what no one tells you. So you will get a C-section date from your doctor. On this date, you will be expected to show up at the hospital at a certain point of time. Many a times they want you to show up early in the morning so that they can get all the C-sections done in the morning, and then whoever is in labor, they can attend to them later in the afternoon, or the doctors can go back to their rooms to consult. So they have specific time slots in theatre. They will give you a time from when you need to be nil per mouth. Nil per mouth means you cannot eat anything. You need to only drink sips of water, also not a lot, so that your stomach can be as empty as possible when you go into theatre. And if they give you a time to show up, this is the last time and the only time that you need to be on time, because there's a sequence of events that need to happen before you actually go into theatre, and usually there are a couple of cases following. So whoever is late first causes a delay for all the others following. So when you get there, be prepared to sign a lot of paperwork and be asked a lot of questions. There's consent for the procedure to be done, like the actual C-section, and there's consent for them to treat your baby, so that you're going to feel like you sign your life away. At this point in time, you would have changed into the hospital gown with nothing underneath, because you can't go in with undies, and they will hook you up to a monitor before you go to theatre to just take a 20-30 minute tracing of the baby's heart rate, and that tells them what is the condition of the baby when you go to theatre. They will take all of your vital signs when you arrive at the hospital, like your blood pressure and maybe your HB, like hemoglobin, the test for anemia, heart rate, all of those things. If you have someone with you, they will most probably get changed at this point, or they will give them scrubs when they get to theatre to change there. When you are wheeled to theatre, hospitals differ, but most of them have a waiting or reception area where you hand the patients over from the ward to theatre or the operating rooms. There you wait until the theatre that you're going to have your C-section in is ready for you. Ready means it's cleaned after the last case, all the sets that they need are ready, the nurses are scrubbed, they are ready to receive you, and they're all prepped now for the procedure. You go in there, and depending on hospital policy, your partner can go in with you and wait in the corner somewhere. But a lot of the hospitals or the theatre rooms want your partner to just wait outside the door while they get you set up with a spinal and on the bed. And then once everything is set up, they usually call the partner in. The reason for this is purely because your partner might be in the way. They don't know what they're allowed to touch or not touch. And we work with sterile fields in the operating room. So you want everything to stay as clean as possible. And you know, dads can sometimes be funny, or they want to pick up something, or they're touching somewhere, putting their phones down, and then it's unsterile. So what they normally do is they let them wait somewhere in an area, get you ready, and then before they start cutting, they will get the partner in, put a chair next to your head, and then that's where your partner will be sitting. Now in theatre, there will be a lot of people doing their own thing. There are nurses. One is a scrap nurse that will assist the doctor. There's a floor one. There's an assistant that will help the anaesthetist with the spinal. And sometimes there are even more floor nurses. And then there's a midwife who will be catching the baby or taking the baby from your doctor. But don't worry about what you need to do or not do. They will tell you exactly. Remember, they do this every day. They have their processes and they will tell you exactly what you need to do. Some doctors put spinals up when moms are sitting on the bed, which means you will sit with your feet all out on the bed, bending over, or even lying down on your side, and they will put the spinal in. The thing with the spinal is just to keep as still as possible. And I know this is a part that scares a lot of women, but let me tell you, and I've said this before, I had my C-section and I'm still sticking to that point. The IV line, the line that I put up on your hand for intravenous fluids, that is more painful than the spinal. Because this one, they just put the needle in and the fluid runs through, and it takes a bit of time for your skin to adjust and for the urge that you have to just not pull it out. When they go in with a spinal, with a very tiny little needle, they inject something that numbs the area before they put the big needle in that's supposed to give you the spinal fluid. So you don't feel the big one, but breaking the skin and going in with that needle is not sore if they give you the numbing agent before. That burns for maybe 15-20 seconds. It's on your lower back. That is numb. The position that you take in is, if you think about a banana, so you curve your back as much as possible. Your chin is on your chest, and sometimes they will give you a pillow to hold, even if your tummy is big, just to keep your shoulders out of the way, or the doctor or a nurse will stand in front of you and you can hold them, or your partner in some instances. Your legs will have a warm, tingly sensation as they inject the fluid. It goes numb almost immediately, and before it goes completely numb, they will quickly position you, put your feet back up on the bed, let you lie down. And some beds have a little bit of a tilt in them that they just shift you not flat on your back, they tilt you a little bit onto the left side because of the big blood vessel that runs here and the weight of the uterus on that blood vessel. If they don't have that, they will have a little bit of a wedge that they will put in behind your back. At this point in time, the scrub sister, who is going to assist the doctor, is already scrubbed up and all sterile, and she will start cleaning your tummy with some sterile or cleaning solution. So you might have some strong smell, like alcohol smell, that you pick up. This is when she's cleaning the abdomen. Either when she's done or before she starts, you will have a urinary catheter inserted into your bladder. Depending on the hospital policy, the nurse might do it or the doctor might do it, but you don't feel that. It's normally done after the spinal is in. They clean your stomach, they put drapes all over, so the only thing that is sticking out once they are done draping you is your tummy. Your hands will be here on the side on little armrest. They take your blood pressure, and what most of them will do is to have a screen up. If you are lying on your back, the screen will be here between you and your partner and the surgical team on that side. It is to keep things sterile so that you can't touch them, but it's also to screen it a little bit so that you can't see much, but also that the partner doesn't see what's happening and how you are being cut open there. At this point, you might have the doctor asking you, can you feel it? And then they will go with some instrument to just pinch here on your skin and ask you if you can feel it. So I'm not going to go into the details of all the layers that they go through when they do the C-section. I'm just going to give you a short description. Once they start cutting, to get to the baby is very quick. You might feel, like I said, pressure and pulling. You might feel your body moving a little bit on the bed sometimes as they are pulling the muscles away to reach the uterus. If you smell something that smells like burning flesh, don't worry about it. It is burning flesh. It's yours. It's not a problem. So different hospitals use different instruments, but there is one instrument that they use to prevent excessive bleeding, and it basically cauterizes a blood vessel the moment you cut it. So instead of, like, when you cut your hand and it just bleeds and bleeds and you have to put pressure, they don't always have time for that during an operation. So instead they use something that burns that little blood vessel close, that it stops bleeding, and they can continue with the operation quicker. But now the baby is out, and the doctor can't pull the baby out from the head. They unhook the head with their fingers, and sometimes they use a little bit of an instrument just to help hook the baby's head out if they're deep into the pelvis. But in order for the baby's body to come out, you can't push, because obviously you're not in labor and you're not feeling anything. So the other doctor will push on your stomach right here at the top, push down, so that the doctor that is doing the delivery can pull the baby at the bottom with someone pushing at the top. That is normal. It's uncomfortable, but it's very quick. Then your baby is out. When they take the baby out, they usually suction the baby. They can show you the baby, boy or girl. If the baby is fine, they can do delayed cord clamping. I've got a video here that you can watch on that. If you are doing stem cell banking, I have another video here that you can also educate yourself more about that. And then they will take the baby, give the baby to the midwife. She goes to the incubator where the pediatrician is normally waiting, and they just do a quick checkup and see, is baby okay? If baby is all fine, they tag the baby, hands, feet, different policies again, wrap the baby up, and then they bring the baby. And this is a typical photo that you always see when people post it on like social media. Here are the parents with a little baby. Sometimes it's possible to hold your baby, and they will give the baby to you for a little bit. But it is uncomfortable because you are basically flat on your back. By that time, they tilt you back that you lie flat. So you're flat on your back, and there's a baby here in your face, and then they're working here. And you have a blood pressure cuff on. You've got a drip on the other hand. It's not the most comfortable position to now hold a baby here. So it will be for a very short time. Then they might give the baby to the dad, or to the other parent. Once baby is out, they're still delivering the placenta, so they are still prodding and working here. The delivery is very quick. That's usually within 5 to 10 minutes. The stitching up in the placenta takes 10 or 15 minutes sometimes, but in all, a C-section is not a long procedure. When the placenta is out, they have to stitch up layer by layer that they've cut through, and there are many layers. There are really nice videos showing exactly the layers that you go through, and I'll drop a few in the description below if you're interested to watch them. From here, once they are done, you have to go to recovery. Now, some hospitals allow the baby to stay with you, which is ideal. So you can actually start breastfeeding in recovery. But other hospitals have a policy that babies are not allowed in the recovery room where they are exposed to other sick people. So depending on the layout and the policies of the hospital, baby might then go to the ward with the other parent, or baby can stay with you. The recovery is still in theatre, and it's just to make sure that you are okay after the operation, that you're not bleeding excessively, and that your pain is managed effectively. You don't stay here for very long. It's usually 20 or 30 minutes. At this point, or even during the operation or before, you might start having uncontrollable shaking. It is a combination of adrenaline, like a proper adrenaline rush, because now things are happening, and some of the medications that you might get.
I don't know about you.
I was shaking non-stop throughout the entire operation and afterwards in recovery. I couldn't talk nicely, that's how much I was shaking, but I wasn't cold. If all is fine here, then you go back to the ward. If you are feeling any pain, that is the point where you tell them, I'm still feeling pain. Please give me something. You shouldn't feel pain because the spinal takes about 6 hours to wear off. So by the time you go back to the ward, you will still not be able to move your legs. And they won't let you get up for at least 12 hours. Depending on the time that you had the C-section, they might get you up after 12 hours to start walking, or only 24 hours. But it is important that you do get up. When they want you to get out of bed, they will take out the catheter and then they will help you to get up. It's important to get up and get going. The longer you stay in bed and you're scared to get up because of the pain, the longer it's going to take to heal. The more mobile you are from the beginning, the better it is. But the first time you get up, make sure that your pain medication is in place. So if you know, for instance, you are due pain medication at 8 o'clock and now it's 7:30. Don't get up, rather ask the nurses, can I get my medication and then I'll get up? Or can I get it a little bit earlier? Because that first time that you get up, if you are due for your pain medication, it means you are running low on reserves and your chances of having a very painful experience to get up and maybe shower for the first time is higher. Rather get like a fresh dose of pain medication, and then that covers you when you get up out of bed, that you're not in too much pain. Now there's a certain way of getting out of bed that it's easier and less strenuous on your abdomen. It will feel like you've done 1,000 ab crunches the day before, and it can be really sore, so you have to protect your abdominal area. If you are on your back, use your elbow as support and try and move here. This is going to be sore because you have to use your abdominal muscles when you do it, but try and protect it at all times. If you need to get up, this dog, use this elbow and the hand. So you push here to bring yourself up to this point, to slide your elbow in underneath, that you're on your side. You're going to use this hand to support more, bring your legs and push up. Also, when you cough, use a pillow like this and press on the pillow, and that way you don't press on any incision site or on your stomach. It just holds the pillow in place and it supports the whole area. Put your feet flat as much as you can. Use this hand to get up and stand up. Remember, when you go home, take your pain meds. You don't have to be brave. No one is going to give you a trophy if you manage without pain meds after 3 days or after 7 days or after 10 days. Take it so that you can be as mobile as possible. Don't lift anything heavier than your baby in the first couple of weeks. Just slowly get your strength back. By your 6 weeks checkup, your doctor will tell you what you are allowed to do in terms of exercise. And remember, everybody recovers differently. If you are feeling pain, if you are feeling like you're struggling a little bit, you've just gone through major abdominal surgery. In the surgical ward next door, someone having like a laparotomy or another kind of surgical abdominal operation, they are advised to stay in bed and rest and take their pain meds and don't do anything strenuous. You have major abdominal surgery when you have a C-section. You're getting kicked out of the bed and you're given a newborn baby to take care of on your own. That, my friend, that's bravery. So you've got this.